The most important things that we look for when we see patients in preventative care is to make sure that the underlying risk factors that will in the future cause them heart disease are addressed. The most known and understood and well treated are hypertension or high blood pressure, high cholesterol or lipid abnormalities in their profiles, and then beyond that we look at a treatment of prediabetes and diabetes and other underlying medical conditions that may affect their cardiac care. The most important thing is to observe symptoms when you develop them that suggest heart disease, and of course chest pain is the number one reason that people come to see us. In addition to that though, there are also other symptoms that patients may experience, and especially in the older population and often in female population or patients who have had diabetes, the most common symptom is actually shortness of breath. And shortness of breath with exertion is an important sign that there may be an underlying heart problem, so we see many patients for that condition. When we address diet with patients, we have to individualize our care because different patients have different needs in their diet. A heart-healthy diet in general does involve avoiding saturated fats and reducing your total intake of cholesterol and other fats, but there are some specific situations in which diet has to be individualized. For example, some patients have to be very restrictive about their salt intake, and I have some patients in whom I actually liberalize salt intake. In a rare situation called postural hypotension, we sometimes need to give patients extra salt. Diet has to be individualized for specific patients depending on what their specific lab abnormalities are and what medical condition we're treating. When patients first come to the cardiologist, they're often concerned that we might find a life-threatening, dangerous situation. Most of the patients that we see for preventative therapy or for evaluation prior to non-cardiac surgery or other procedures. Most of the time, those tests end up being completely normal and we're able to reassure the patient and proceed with their next step. There are sometimes minor adjustments that we need to make to their treatment. Most of the time, we can allow patients to proceed with whatever else they need to have done. Heart screening is really important in finding out about conditions that you may not be aware that you have and doing preventative steps to prevent it from actually causing harm. Treating high blood pressure is really important in preventing stroke, and stroke is one of the most horrific disabling symptom or problem that someone can have. The second issue is preventing coronary disease, and coronary disease occurs in a very large percentage of the US population. Retarding or slowing down how fast this progresses over time is another important step of what we do. We do that by adjusting cholesterol medications as appropriate and diet as appropriate, and then screening to see if the disease process has gotten to an advanced stage where it needs more aggressive medical or intervention or surgical intervention. Stress management has an important role in cardiology, but it's a very difficult skill to teach a patient. I find that one of the most important ways to try to help patients manage stress is to incorporate routine daily exercise into their life. Exercise allows you to benefit from training, but also takes your mind off the other things that are going on in your day, and it is a very good stress reliever. So I'm a very big fan of adding exercise as part of a stress management routine. I believe both cardio and strength training are important, but to us, cardio training is the most important. And so what I try to tell patients to do is to at least make half their workout cardio. It's really important to keep in mind that the most important muscle you're training is your heart. And for good health, that's what the focus should be. So I try to tell patients to do a 50-50 split. Managing medications is a really big part of what we do, and explain to patients when to take their medicines and how to take their medicines, and making it easy for them to remember to do it is a key part to this. I think compliance is a very big issue in cardiology. I saw a patient yesterday and had been started on blood pressure medicines and stopped taking them about 3 days after he started because he forgot. There are steps that we provide patients to try to give them reminders. I often tell patients to use tricks like putting their medication bottles next to their toothbrush so they remember to take their medicine when they brush their teeth, or I will have them set up alarms on their smartphone that will remind them to take their medicines, and this way we try to encourage patients to take their medicines when they're required to.